Hi, thank you for joining us for this episode of Healthy Living. Today we're going to talk about all about orthopedics. So recently we expanded the Bone and Joint Clinic in Covington, Louisiana. So to start the conversation about the Bone and Joint Clinic, I have with me Dr. Roch Hontas. He is an orthopedic specialist at the Bone and Joint Clinic in Covington. So welcome, Dr. Hontas.
Thank you, Amy. Thank you for having me this morning.
Thanks so much. We know that the expansion has occurred and it's beautiful. I wanted you to speak a little bit before we talk about the Bone and Joint Clinic expansion. Talk about the history of the Bone and Joint Clinic to this community. What does it mean?
The Bone and Joint Clinic is the oldest orthopedic clinic on the North Shore. It was established originally in the 60s. And my brother, Roch Hontas, joined the office in the mid-80s. And it has continually expanded since then. And when you include our brother group of orthopedists with Ochsner Clinic, it is not only the oldest, but it is the biggest orthopedic clinic on the North Shore.
And a very comprehensive slate at the Bone and Joint Clinic.
Well, that's exactly right, Amy, and that's exactly what our intent was. Originally, as I said, it was just my brother and I for many years, and then we joined the Ochsner Group with our affiliation with them, which essentially gave us 4 immediate new partners. And then in 2016, Dr. McDaniel joined us. 2017, Dr. LaMartina joined us. And then just this January, Dr. Matthew Webb joined us. So when you look at all of their specialties, it is by far the most comprehensive orthopedic clinic on the North Shore. You'd have to go to New Orleans to find the diversity of interests and specialties and talents that we have in our clinic.
That's wonderful to know. And it's nice to know that you can stay right here and get the care that you need. So when we talk about the Bone and Joint Clinic expansion, why did you expand? What made you want to do that?
For a couple practical reasons, Amy. First, as I said, my brother and I had been in the office together. We had thoughts about expanding. When Ochsner came on board in 2013, it gave us a little bit more flexibility. But then when we really made it our intent, and with the total backing of the Board of Commissioners and the administration of the hospital, that we were going to expand and make this a very comprehensive clinic, quite frankly, we just needed more room.
Yeah.
So it really took on a life of its own. I believe it was probably 3 or 4 years ago when we first started developing the concept of the addition. Shortly thereafter, we felt that adding about 2,000 square feet of space for physical therapy would be a benefit to our patients.
Right.
So we included that in the expansion. And then it gave us room for Dr. McDaniel's practice, Dr. LaMartina's practice. We were anticipating adding Dr. Webb at that time. So it really came about all at once, and it really benefits not only us, but certainly the patient flow through the office as well.
Yeah. So what are some little amenities that you are super proud of in there?
We have 25 exam rooms. We have 2 x-ray rooms. We have 2 cast or procedure rooms. As I said, we have about 2,200 square feet for physical therapy. We have 2 separate entrances. We have an entrance in the back for Dr. McDaniel's patients as well as physical therapy, and then a waiting area in the front for the adult orthopedic patients. So we have 2 entrances, which was a very, I think, works out very well for the patients. And just the way the office flows, in a sense, you have several offices all molded into one, but the flow is very, very beneficial for the patients.
Yeah, and you talked about the cast rooms, the x-rays. So if I'm coming in as a patient, there's a lot that can be done right there in the office for me.
Well, we really intended it to be just like that, Amy. We wanted to make sure that our patients don't need to leave. And when you add not only the Roch Orthopedist, which gives us a much more variety of interests and capabilities and specialists there,
Right.
but then when you tie in the other specialties that the St. Tammany Parish Physicians Network has,
Yeah.
with general surgery, the vast primary care clinics that they have, cardiology, and all the other physicians that are aligned with the hospital, it really gives us the ability to make sure our patients can be treated here. If we need to refer them, we don't need to refer them to New Orleans. We can treat everybody here on the North Shore.
Right, and it gives you that collaboration too, I would imagine, where you're kind of bouncing ideas off of one another, talking about cases in depth and things like that.
Well, there's rarely a day that we don't refer either to one of the specialists at Oshno or they back to us. And that's not even taking into account the referrals to, again, other physicians in the network. And it just makes it so much easier. We're on the same computer system.
Right.
So it's not like your primary care doctor is on this system, electronic record system, and then this doctor's urologist is on this one, and then your OBGYN is on this one.
Right.
Everybody's all in the same system, and it's really helpful in trying to capture information, and really it helps in treatment of the patient.
Yeah, streamline of care. I mean, it's wonderful.
That's no
so
question.
what are your patients saying about that new therapy space in the back?
Well, I'll be honest, I think they're much more willing to be treated there than I anticipated. Therapy is a very unique type of practice. Sometimes it's, certain therapists have their interests.
Right.
And then, of course, location is very important. It's hard for someone from Mandeville to come over to Covington, or someone from
Sure.
Washington Parish to come here just to go to therapy. And that's why you see so many therapists out there. But we were very lucky in getting a physical therapist, Cameron, who joined us in August of last year, and he's been wonderful in treating our patients. And now not only are we, before I even get to propose the idea of patients being treated there, oftentimes patients are asking, by word of mouth, can I be treated in the back? Can I have
Right.
therapy in the back? And of course the answer in almost all cases is yes.
Another streamline of care option. I mean, that's just so nice. Time, as a mom, time. It's the most important thing in my life, really.
Sometimes just walk on down that hall. and
Exactly.
We'll get you taken care of, and it's oftentimes we can start seeing them on the same day.
Yeah. So let's just talk about practical things in the world. Spring is here. Athletics are ramping up. You're an athlete yourself. You played for Tulane for years. Everybody knows.
In my
This is
previous
the original
life.
Dr. Roch Hontas, okay? So what do you say to athletes, to coaches, to trainers? Because everybody's gung-ho. The weather's nice now. We're ready to get out. We're ready to start training. We're ready to start doing all things. How do you protect yourself? How do you protect your bones?
Well, a couple things that I could give as advice. First of all, know your body. Listen to your body, understand your body. When you get beyond the high school and college ages where you seem almost to be bulletproof, as you get older, those things, it's the same injuries, it's just the injuries affect you a little bit differently.
Right.
So there are very few things that we really recommend that you power through. Listen to your body. If your back hurts, if your shoulder hurts, if your elbow hurts, if your knee hurts, listen to it. Mm-hmm. Come see about it. Second thing, of course, is now with pickleball being so popular, we certainly recommend stretching.
Okay.
Before and after. People forget the importance of stretching after
What is the
working
importance
out.
of stretching
Well,
after?
when you work out, of course, your muscles are loose, you're stretched out, and then if you stop abruptly, then they're going to contract, and then you get stiff.
Okay.
This, by stretching, you maintain that flexibility, and really it's flexibility as you age that is the biggest, the most common thread as far as injuries are concerned. We lose our flexibility, and I always encourage patients, even before you get into any kind of problem with an injury, continue working with your flexibility, maintain your flexibility, and that may prevent some injuries from occurring.
That is really good to know. I really didn't ever understand the importance of stretching after. So I guess we're going to wrap up our conversation here. We're thrilled about the Bone and Joint Clinic. Let's say the location of it. The location of the Bone and Joint Clinic is at 71211 Highway 21 in Covington. And if you want to schedule with you, Dr. Roch, you would call 985-893-9922.
Yes, we encourage new patients to call that number.
Okay.
It's nice to get them in the system, and all of our receptionists can assist them in getting into the system. Established patients can also call that same number, but now we've learned between 75 and 80% of our patients are on my chart. So established patients, we encourage, if they want to, if they're inclined to get on my chart, and they can make appointments through that.
Very easy to do. So anything else you want to add?
No, we're just, I can speak for Dr. McDaniel, Dr. Webb, Dr. Lamartino, my brother, Dr. Mark, just how proud we are of our association with St. Tammany, and through that, with the Ochsner physicians. And we just appreciate all the help that the administration and the Board of Commissioners has given us in getting our practice established as it is.
Wonderful. Well, thank you so much again for joining us. We loved having you here. And stay with us, because coming up next, I have Dr. McDaniel. She is also at the Bone and Joint Clinic. She is a pediatric orthopedic specialist. So we'll be right back. Stay right there.